Buddy. Well, first of all, I hope everyone had great Christmas, great holidays, had a chance to be with loved ones and friends and just have some time to reflect and enjoy. I hope everyone had a great time. And another holiday upon us, Kwanzaa, started yesterday. Yesterday's principle was umoja, unity, something we need so much of at this moment in our city and our country, and everyone can be a part of creating. Today, we honor the principle of kujichagulia, which means self-determination, and this is very pertinent to everything we're trying to do as we build the future of this city in terms of the importance of not just coming back after COVID, but coming back better, fairer, more just, more inclusive. That's why we create our task force on racial inclusion and equity. Leaders of color in the city government who brought forward powerful ideas that have been put into action to create more equity, and that's going to continue. Our Racial Justice Commission, about to put out its report, powerful changes that will make an impact for this city for years to come. We honor this principle in action, and I wish everyone a very, very happy Kwanzaa and happy holidays to all, and get ready for a very, very happy new year. Now, to get to a happy new year, obviously, we've got to keep fighting COVID. We talk about it every day. We've seen a huge uptick. We all see it. The Omicron variant, as advertised, and more, the speed and intensity of it. Now, thank God, so far, we're seeing the cases are generally speaking mild, but we are not letting down our guard one bit. And the key is always vaccination. We want to keep promoting vaccination, deepening vaccination every way. We announced the booster incentive back on Tuesday. I'm very happy to say New Yorkers are responding. Almost 180,000 New Yorkers have gotten that booster just since Tuesday. 180,000 more, and you've got till the end of this week, Friday, to get that $100 incentive. It is a wonderful thing. It's working. Go take advantage of it. We're almost up to 2 million New Yorkers who've gotten the booster. We want to see a lot more. Today, also, we make history in New York City. We lead the nation with the strongest vaccine mandate anywhere, private sector vaccine mandate, reaching hundreds of thousands of businesses. And we put this mandate into action as Omicron was coming, but we had no idea it would be quite this intense. But we knew with Omicron coming, with cold weather, it was time to do more. Well, thank God we did, because these mandates have been absolutely necessary to keep the city going. The reason the city keeps going, the reason we are open when some other places are shut down, is because of our focus on vaccination, because we use mandates and incentives. We got to double down, because one thing we can all agree, and I've talked to a lot of business leaders about this, COVID is bad for humans, it's bad for our health, but it's also bad for business. And if we want to avoid shutdowns, and I believe we must, we need more and more people vaccinated. So today, the mandate goes into effect for the entire private sector in New York City, all employers. This is how we get people vaccinated. And we've been engaging business leaders, a lot of questions and concerns, which we're working with them on, but also a lot of recognition that this works. And it's better that it's something universal for all. And we need to keep doubling down on vaccination to get out of the COVID era once and for all. I want you to hear from someone who's been an extraordinary voice during this crisis. He has been an advisor to me and my administration, helping us navigate COVID and many challenges before. He's a national leader, runs the founding director, in fact, of the National Center for Disaster Preparedness, director of the Pandemic Resource and Response Initiative. He advises President Biden and has advised leaders over the decades in this country. And I want you to hear from him now. My pleasure to introduce Dr. Irwin Redlener.
Well, thank you very, very much, Mayor de Blasio. It's been a pleasure to work with you and your administration. And one of the great pleasures is that, you have shown over and over again what leadership in a crisis is all about. And I think this really incredible move that you're implementing today is a major step forward. And I promise you it will be emulated by cities all over the country, if not all over the world. And so here's the thing about this. We are not in the horrendous, deadly situation we had in the spring of 2020, where we had, mobile morgues outside of hospitals and so on. The city was falling apart, as was the country and the world, really, from the COVID perspective. But what we have now, though, is the availability of vaccines, the magic miracle way. It's not a miracle, it's a medical innovation that is extraordinary to keep people from getting sick. Now, has that eliminated the threat to our city and our residents? No, it hasn't. We just heard from the state information that more and more children are being admitted to hospitals. I was visiting a hospital in New York City the other day. Here's the report I got. Every single bed on the COVID floor was taken. There were also COVID patients in the ICU, a lot of them. The difference, the patients that were admitted were sick. The patients that were and vaccinated or not vaccinated, but sick, probably with the Omicron variant. The patients that were in the ICU, 100% not vaccinated. We have become a country, in some ways a city, a two-city situation where we have vaccinated and unvaccinated New Yorkers. The goal now that the mayor is expressing is we've got to get those vaccination numbers up. It's going to be a long haul, but it's absolutely critical to getting where we need to go. And I could not be more supportive. And like I said, I think many other cities are going to follow these footsteps. Listen, this is not the raging battle of March 2020, but it's a smoldering fight against a deadly disease, which basically kills people. The mayor wants you to survive this. He wants you to thrive. And I think these steps are absolutely critical. Look, here's what we got. We have vaccines, we have testing, and we have the ability to stop transmission. And really, all of these things are involved in the mayor's strategies, which have been unfolding and culminating in this very, very special day. And I just congratulate him and thank him. We have a national leader on COVID defense and in our mayor, and I'm grateful, and I hope all of you are. But I think this is absolutely the right step going forward. Thank you, Mayor.
Thank you, Erwin. And Erwin, you have been extraordinarily helpful in guiding our policies and approaches over the last few years. And I know your voice is heard all over the nation. So I know you will sound the message far and wide that these mandates work and we can use them to end this COVID era we've been living through. Just thank you for being so committed to the people in New York City and giving of yourself to help us through this crisis. Thank you, brother.
Of course.
And everyone, a reminder, in addition to the private sector vaccine mandate taking effect today, also today, with the Key to NYC, our extraordinarily effective initiative to make sure that everyone is vaccinated in indoor dining, entertainment, fitness. We're now going to a 2-dose requirement as of today for everyone 12 years old and up. So you know that people are well protected when you go to the movie theater, when you go out to dine, whatever it is, everyone well protected, everyone keeps each other safe. Okay, now we're going to do something very special. We have a very special guest with us, joining us from very, very far away, joining us across the ocean, but we share a deep bond and we share values and have been on a journey together. We're going to hear in a moment from the Mayor of London, Sadiq Khan. And we're going to talk about a couple of different issues. But I want to start by saying I have such respect for what Mayor Khan has done in one of the world's great cities. And for a New Yorker to acknowledge the greatness of another city, well, that takes a little something in us, but it's true. London, one of the great global cities, and what Mayor Khan has done is create a more equitable, more inclusive London. He has been a positive symbol to the whole world, but he's also a friend to me and a colleague who I value dearly. And Charlene and I have gotten to know Mayor Sadiq Khan over his last few years, and we've shared together vision and approaches and ideas and commiserated sometimes what's going to work, how do we do this, and it's been a special bond. And I just want to say to him, I honor you, my brother. You have done amazing things, and it's a real special pleasure to have you with us today. We're going to talk about Thrive and mental health. We're going to talk about congestion pricing, two things that near and dear to Mayor Khan and London has done so well. And it's my great pleasure to bring to all New Yorkers from across the pond Mayor Sadiq Khan.
Well, listen, Bill, good afternoon from London. Good morning in New York. It's a pleasure to join you today. This is a public holiday in London, but when I got the chance and the opportunity to join you at your press conference, I couldn't but say yes. And my best wishes to your family and to all New Yorkers. It's really good to see New Yorkers taking advantage of the game-changing, life-saving vaccine. The vaccines and the booster, the most unselfish thing you can do. And please, please, please take the vaccines, take the boosters. Look, Bill, I really wanted to join you to say thank you. Thank you for your friendship over the last 5-6 years whilst I've been mayor, but also before that as well. But also to share with you some of the fruits my city's benefited from our friendship. You'll remember on my first ever international visit, I came to New York and you invited me to Gracie Manchester to meet your family and to have supper with you and the First Lady. And the First Lady spoke with passion about her commitment to deal with the issue of mental ill health, dealing with the stigma, dealing with how we educate ourselves more about mental ill health and what we do about it. And I'm very competitive, Bill, as you know, and I was really impressed by the First Lady's Thrive NYC. And I thought, well, if New York can do this, I would argue, Bill, forgive me, the second greatest city in the world, why can't the greatest city in the world? And so I took what the First Lady taught me, what she explained to me, and we set up in London, Thrive London, learning from your great city. And here's the good news, Bill, and I particularly say thank you to the First Lady. I'm afraid more than a quarter of Londoners suffer mental ill health. Because of Thrive London, we're now helping them. We now have first aid mental health training. We've now set up a good thinking app. We've now collated in one place a crisis number, but also we've given confidence for leaders to talk about mental health and mental ill health, what we do about it. And you will know that actually this pandemic has both exposed and exacerbated physical health, but also mental health. And I just want to thank the First Lady for your friendship, but also sharing ideas. This is not a competition, it's a collaboration. And so we're going to build on the legacy that you and the First Lady have set up in London, a good example of our friendship leading to real benefits for Londoners as well as New Yorkers.
Sadiq, I can't thank you enough for what you're creating there for everyone, and it's going to spread around the world. And I want you to hear from Shirlane. You and I will come back in a moment to talk about another important issue, but I want you to hear from Shirlane because I remember that dinner vividly, and I remember the passion that she expressed about the change we needed to make. And she's made it here, and it's reaching all over the world. My pleasure, everyone, now to bring into this conversation our First Lady, Shirlane McCray.
Good morning.
Good morning.
Thank you, Khan. It is so wonderful to see you, and congratulations for all you've been able to do to change the approach to mental health in London and to help end the stigma. As you know, Thrive came about after we had listened to what New Yorkers told us about their own personal and family experiences at town halls all over the city. And we looked at other cities and other countries to see what had worked well and learn from others. Thrive was always meant to be shared. The lessons that we learned were always meant to be, shared freely with anyone who wanted to figure out how to give more support to people in their communities, in their families, make sure people have easier access to care from people who know them, but especially more education. And we know that education goes a long way to help people understand how to prevent crisis and more serious illness. And we're still encouraging people to look at mental fitness the same way they look at physical fitness, beginning at a young age with programs like social emotional learning. I'm so proud of what we've accomplished in our city in these past 8 years and so grateful for our partnership, Mayor Khan. I wish I had been able to come and do the conference with you this past summer and to see the work that Thrive London has done, especially during this pandemic. But most importantly, I'm just thrilled that Thrive will continue to inspire others Thrive Here has grown. It's now the Office of Community Mental Health and a permanent part of city government. And so it will continue to inspire people everywhere, I hope, and thanks to you and so many other mental health champions. As Bill said, if two of the biggest cities in the world can be partners and innovate together, what other problems can we tackle together? Maybe we'll find out in 2022. I hope so. Thank you, mate, and best wishes to you in the new year.
A nice British twist there, Charlene. Thank you so much, Charlene. And Sadiq, I want to just say to you, we have been fighting through this pandemic, both of us and our teams and our cities. But we also know when we do put the COVID era behind us, we're going to be dealing with the great existential threat of our time, climate change. And you've been a leader globally on this. I want to thank you for that. The leadership you provide among mayors and leaders around the world has been profound. I just want to talk to you now about something that you have, and now I'm going to give you the greatest moniker, because you have something that we should have, which is congestion pricing, to reduce emissions, to create a healthier city, to reduce congestion. We need it here in New York City. We don't have it yet. We're fighting for it. I think it'd be great for New Yorkers to hear from you what congestion pricing has meant for London, how and why it works. We need your voice now, because we're still not there yet.
Well, listen, thank you, Bill. And can I just say, by the way, before we move off mental health, having the First Lady talking about mental health is really important to address the issue of stigma. And I took a lead from her book, and I talked about my own challenges last summer because of the pandemic. And so thank you, First Lady. And you're right, we are mates. And cheers. Let's move on to the issue you asked me to talk about, which is congestion pricing. Can I explain what we're dealing with here? And it's really important for New Yorkers to understand. According to independent experts like the World Health Organization, climate change, air quality, transport, they're all linked. And the bad news is 9 out of 10 people who live in cities suffer from the consequences of poor air quality. And what we have to do is to encourage people to be less reliant upon their car and to, where they can, walk and cycle and use public transport. And the lessons I can share with you from London is congestion pricing leads to a reduction in traffic congestion. It leads to an increase in average speed for those who do have to use their vehicles. It leads to an increase in the use of public transport. It brings in revenues we can invest in transport infrastructure, and it leads to less carbon emissions, less toxicity from our vehicles, so improved health. It's what I call a win-win. And I know it's hard, but here's the real challenge for us. If we don't have fewer people driving, and in global cities like New York and London, if more of us rely on our cars, how can we address the issue of climate change and air quality and show moral leadership to the global south? And the thing that you and I both know, Bill, is it's the poorest New Yorkers, it's the poorest Londoners who suffer the worst consequences of congestion and poor quality air, who are less likely to own a car. And that's why this policy that New York I hope embarks on is a bold one, it's a brave one, but the benefits are going to be humongous for New York City, for the state, and for your country, because you'll be showing, again, leadership here.
Let me thank you, Sadiq, because I think the fact is that we have to be more urgent than ever in addressing everything in the climate crisis. And you know, and I know so many times a great idea is there, but it doesn't move because, yeah, it's challenging, it's bold, you're right. But I really take inspiration from what you've done in London, and you've proven it works. And you've proven that these big, bold things can actually lead to transcendent change. And I mean, it would be great, I think, for New Yorkers to hear one more thing. You lived in London before congestion pricing. What does it feel? How does it feel different? Because I think people need to start visualizing how this can make our life better.
Well, firstly, this stage you're going through is tough. It is tough. It is challenging. There are always going to be people who say you're going too far. Some people will say you're not going far enough, and that often means you're doing the right thing if you're being criticized on both sides. But these bold policies lead to transformative change. The problem with the toxicity in our air is it's invisible, you can't see it. So there were challenges. I'm not going to pretend there weren't challenges. There were lots of people who were resistant to change. There were the inverted commas business as usual crowd. And we persevered, and we built coalitions, and we took people with us. I think you're spot on having these town hall meetings, engaging, listening. My advice is to New Yorkers who aren't yet persuaded is be bold. There are very few other alternatives to reducing transport usage, and those that need transport can use it. And the other thing that we did is I realized that the black taxi in London is an integral to how people get around. So we exempted the black taxi from congestion pricing for obvious reasons. We also made some exemptions and gave some discounts to other groups. And so those are the conversations that, of course, you need to have. But it's a bold thing for you to do. I'll tell you this, Mayor de Blasio, if New York does this, you'll be setting other cities around the country on a similar path, and you'll be showing bold leadership. And I think it's really important. When New York goes first, other great cities in America will follow suit. And it's a really exciting part of New York playing its role in addressing a big challenge. Climate change and air quality are the two biggest challenges over the next decade. Wouldn't it be exciting for New York to be leading the race in addressing these problems?
Thank you so much, Sadiq. I love very much you always have an energy and a hope about you. I remember when I first met you in Manchester years ago, I could see it. And this is what people need, especially after everything we've been through the last few years. So I just want to thank you personally for your friendship. You've been a brother during this whole storm we've been through, but you just set an example to the world in so many ways. I really feel. I hope even in the midst of the day-to-day struggles, you know that people watch what you do around the world, and we take a lot of energy and inspiration from it. So God bless you, brother.
God bless. Stay safe. Love to New Yorkers.
Thank you, brother. So everyone, look, Mayor Khan, what a powerful voice. And he's telling us something that I think hits home. It's time for congestion pricing in New York City, and this just keeps dragging on, and it shouldn't. He's right. We got to be bold. And of course there will be concerns, and of course there'll be things we have to do to address the concerns, but we can't just sit still when we're dealing with a climate crisis. We're dealing with a congestion crisis too, greater than ever because of COVID, because everyone's back in their cars. We can't keep going like this. And we got to improve our subways. I mean, today, people are reporting all sorts of delays on the subways. We need to invest in our subways, make them better, our buses, make them better so people choose mass transit. Congestion pricing will lead to a $15 billion investment in mass transit. A staggering figure that's going to have a profound impact. Congestion pricing will reduce congestion in the city greatly, and it will make it a healthier, greener city, help us address asthma and so many other health challenges. It's time. So what are we waiting for? So I got to tell you, New York City's not waiting. There was one thing we had to do, and we did it back in July. We needed to name a member to the body that would make the rules. Has a very elegant name, the Transit Mobility Review Board. I named our Finance Commissioner, Sharif Solomon, who's an expert on these issues. I named him in July. The state, the MTA, have not named anyone. They haven't done anything yet. We're running out of time. 2021's almost over. So I am appealing again, as I've done before, to the state of New York, to the MTA, name the members of the board. Let's get going. Let's start to make decisions. And I agree with Mayor Khan. What they call black cabs in London, we call yellow cabs here. We should exempt yellow cabs from congestion pricing. Yellow cabs are needed. They are part of our larger concept of mass transit in this city. They've been through a lot. We just had a major effort earlier this year to help cab drivers, taxi drivers who have been through so much with all of the challenges the last few years. We got them some real relief. We have to make sure that the taxi drivers in New York City, iconic part of the life of the city, are protected. So let's exempt yellow cabs from congestion pricing, keep that part of our city strong, keep that part of our mass transit strong, and focus on saying to folks, it's no longer time to bring that single individual vehicle with one person in it. That should be something that happens less and less and less. We don't want people coming in from all over the metropolitan area, one person in a car, driving in to the city, in particular Manhattan, creating a problem for everyone else. Let's get back to mass transit. Let's get back to cabs. And if folks do choose to come in their private vehicle, then let them pay a little bit more so that we can keep improving mass transit, keep reducing congestion. This works, and look, we know it because we have example, one of the other greatest cities in the world, London. They've proven it works, but we got to feel urgency now. Last thing I'll say on this, I mentioned it, but I want to put a point on it. We're fighting COVID now. We have to end the COVID era. But once we end the COVID era, right in front of our faces, we're going to be focusing on the climate crisis. This will be the issue. The existential crisis, obviously, is going to be the thing we are all going to urgently be working on. And to get it right in this city, we need congestion pricing. If we're going to fight the climate crisis, we need congestion pricing, and we need it quickly. All right. What a great joy to have Sadiq Khan join us, even if remotely. But now we have someone joining us live, and this is an extraordinary pleasure and honor for me, because for any of us who came of age in the 1970s and 1980s, there were many voices out there, many artists out there, many musicians out there, but there was only one Patti Smith. And I don't mean that as like a easy truism. I mean that as something deeper. To me, Patti Smith had an authenticity and has an authenticity that you just didn't find, in my view, that many other places. An ability to cut through all the swirl around us and speak some more profound truths. The punk movement in general, to me, was a bastion of truth-telling and something that helped address the hypocrisy in our society, and therefore, by calling out that hypocrisy, gave us hope. Some have called Patti Smith the godmother of punk. I think it's a fair phrase because she inspired so many people, helped shape a whole movement, a whole artistic movement, and in many ways, a political movement as well. Her work as a musician, as a singer, as a lyricist, as an activist, so many elements influenced so many people and showed people a way. And I think this is, when we honor people, I particularly think about the pathfinders, the people who showed the way to so many others. There's a lot of artists out there who realized what they could do and what they could say because they heard the works of Patti Smith. She got together with Lenny Kaye almost 50 years ago, and they created something amazing. And the Horses album in particular, 1975, considered one of the great and most important rock albums of the entire history of rock and roll. Many wonderful songs, and I love many of them, but Ghost Dance is one that I am to this hour moved by. The first time I heard it gripped me, and every time I hear it again, grips me. That was from her album in 1978. Unbelievably powerful to me and among so many others. So she has done so much to light the way, and she has done it here in New York City and was a quintessential member of that musical blossoming that happened in the 70s in this city and beyond. So talk about someone who has enriched us and given us hope and brought along a whole generation of incredible and talented people. When we give the key to New York City, I always like to think of the people who just their impact just keeps growing and growing and growing. And that is the truth about Patti Smith. So it is my pleasure to present to you the key to New York City.
Thank you.
Feel free, sit down and talk to the people.
Thank you so much. It's awesome. Wow. I was thinking this morning when I learned of this honor, what have I done in New York City? What have I given New York City to earn this? But the most of all, I kept thinking of what New York City has given to me. I came here in 1967 from a rural area of South Jersey. I had just a few dollars in my pocket, nowhere to stay, no real prospects, but I came here to get a job and to see what I was made of. And I found that the city, with all of its diversities and possibilities, if you're willing to work, if you maintain your enthusiasm, you'll make it. And I got a job in a bookstore. I met so many wonderful friends. I evolved as an artist. I met Robert Mapplethorpe and Lenny and Sam Shepard and so many people who I evolved with. And I left New York City in 1979. I went to Detroit, married my husband, Fred Sonic Smith. I had 2 children. When he sadly passed away in 1994, I returned again to New York City with my children. Again, it was hard times. It was very hard times, probably the hardest time in my life. Again, with hard work and enthusiasm, the city embraced me again, gave me another chance to rebuild my life and continue to evolve as an artist. So I wish I could give New York City the key to me, because that's how I feel about our city. With all its challenges and difficulties, it remains, and I'm quite a traveler, the most diverse city to me in the world. The city that has so many possibilities, so much possibilities for growth, but also as we grow and again evolve as a city, I pray that we will also protect our city, its history, its historic streets and architecture, its community gardens, its trees. All of these things we need because they are part of our identity as New Yorkers. Also, the Empire State Building, new skyscrapers, progress, but also the small things. That is part of our great city, the small things. So let's all do our best to protect those small things. And this is so encouraging because it's been a difficult year for all of us, a difficult 2 years. But I always think of my parents and my grandparents. Our ancestors have gone through world wars, their own pandemic, the Great Depression, and they always forged through. They came out of it with hope. They brought us into the world, and we can do it too. We are navigating heavy seas, but we are all small or large captains, but we can do it. We can navigate our part of our little sea, our little area of difficulties. We can do it if we stay strong and grateful and remember our mothers and fathers and grandparents and what they had to do in order to bring us into the world and all of the strife that they had to surmount. We can do it too, because that's who we are. We're resilient people. And who's more resilient than a good old-fashioned New Yorker? So
Beautiful.
thank you. Thank you.
Beautiful. Patti, I gotta ask you one thing. It was absolutely beautiful what you said. And I think there is, because it's been so hard and a shock to everyone these last years, I sometimes confront people who don't remember what you just said, you know, sort of lose a little bit of that perspective and feel a little too hopeless. And I understand it's hard. So I always, if someone's feeling hopeless, I feel empathy. But I want to remind them that, you know, whatever our challenge, there's something we can do. And of course, the message, people have the power. What do you say if someone's saying to you, oh, you know, just things are so bad, there's so much division, we can't do anything about it? What's your way of encouraging people? What's your message to people who are feeling hopeless?
I always start with the small things. Just as I was speaking of, you know, some people tend to our community gardens. Some people, they have a neighbor who is sick, will make soup, leave it outside on their stoop. I have seen all these little small gestures. You know, there's litter on the streets, they pick it up. Just doing what one can to reduce their own waste, to reduce their use of fossil fuel, any small gesture, and feel good about your small gestures, because we are who we are through our accomplishments, but all of our accomplishments. And I think it is a good thing to embrace our small accomplishments. If it's just, you know, helping someone who's having a difficult, it's the old story of helping the person cross the street. But these are wonderful things. And each good turn, each good deed that we do magnifies. And I think that's, if we don't have the capable of making big change ourselves, we can join others and be helpful. That's what People of the Power is about. It's about the power of the individual, but then the greater family, the greater power, which is all of us unifying and making change. Because only the people, artists, politicians, all of scientists, we can all inspire people, but it's the people who make change. And they make change by voting, by helping one another, by fighting for the things they believe in. So I would say, start with the small things. And, you know, and there's nothing more healing than a smile.
Amen.
And just find something every day to be enthusiastic about, to feel encouraged about, because that's part of physical and emotional mental healing, is allowing joy to eclipse fear and doubt. So I know it's what my father always said. If you ask my father, and my father read the Bible, Socrates, all kinds of Jung, but when you would ask him, you know, what's the most important thing in life? And he would always say the same thing: be happy. Because if you feel happy, it will spread like your blood in your veins. It will magnify your spirit.
I love it. And you have lived that. You have lived that. You have lived it for all, and we've all felt it. And in addition to Key of the City, we have a special salute because on Thursday, it's your 75th birthday.
Yes.
And today, Lenny? Yeah. Today is Lenny's 75th birthday. So we have the incredibly elaborate presentation here. Come on, bring it on up. Bring it on up. There you go.
Oh, thank you. That's awesome.
Okay, now you each get a wish. We'll let you think about it for a second. Beautifully done. Look at that precision. Excellent. Happy birthday.
Thank you.
And if you and Lenny would like to send a little musical message to the world, we welcome it.
All right. Just Thank you. I love this.
We love you.
I really, I know that we don't work to gather accolades, but I'm the kind of person that if I get one, I really love it. So, and I love the key. It's beautiful, and it also, to receive this at 75, it just makes me look even more forward to the next 25 years.
I like it. Amen.
So Lenny and I wrote this song in 1978. It's really, well, the essence of it is the collective, a collective hope and also the collective power of the people. It was written specifically to honor the Hopi Indian tribe, but it's also a message to all people. What is it, children, that falls from the sky? Tai, 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 manna from heaven, from the Most High, food from the Father. Tai, tai, we shall live again. Shall live again. Shake out the ghost dance. Give to your brother, give and take it. Tai, tai, hold its little feet. One foot extended, shake to the ground. One foot extended, worm turn around. We shall live again. We shall live again. Shake out the ghost dance. Stretch out your arms, now dip and sway. Bird of thy bird, tie, tie. Blow off the shoe, the ghost of the soul, dust of the word, the shakes from the tail. We shall live again. We shall live again. Shake out the ghost dance. Here we are, Father, your holy host, dust of thy dust and ghost of thy ghost. We are the tears that fall from your eyes, word of thy word and cry of thy cry. We shall live again. We shall live again. Shake out the ghost dance. We shall live again. We shall live. What is it, Father, that floats in the night? What is it, Father, that moves through the light? What is it, Father, and tell shake out the ghost dance. Shake it out, everybody. Shake out the ghost dance. Woo!
Undoubtedly one of the coolest things that's ever happened at New York City Hall. God bless you.
Thank you.
Thank you, thank you.
Thank you.
Brother, thank you.
Pleasure. It's a pleasure.
Thank you, thank you. Unbelievable.
Well, I came here with nothing, just like when I first came to New York, and I'm leaving with a cupcake and the key. Thank you.
Beautiful. I love that. Oh my God. It just reminds me that that's what people used to do. They used to just play music in a room together. And that like takes you back through the ages. Amazing. Patti, Lenny, thank you so much. Thank you. Thank you.
Thanks.
Well, we shall live. I like the way Patti left it just as clear as that in the last verse. And I think that song's moved me to the core for decades and decades. I can remember when I first heard it, just being blown away. But what a message for this moment, that we have to live and we shall live, and we got to stay by each other, and we got to take care of each other, and we can do it. And this is what, over all these last 2 years, whatever we are talking about, the specifics, the message is we shall live, and we can do this together. And I loved hearing just the faith and the hope that you heard from Patti, her own journey here in New York City, but also just faith in what this place can do for people. And it's still true. It's been true for generations. So that is our mission together, my friends. We continue it. Well, back to a little bit more mundane matters, but very much in the same spirit. We talk about indicators. I always start with the first one, the doses administered to date, and I always remind people, talk about the way Patti just described about those small achievements, those acts of hope, the way they ripple outward. Well, over 13 million times a New Yorker has come forward to get vaccinated, and someone was there to give them that vaccination, and someone who cared, someone who helped them. Talk about those ripples of hope. It's happening every hour, every day here in the city, and what an impact. So to date, 13,101,389 doses, staggering figure, and the reason this city keeps going. But now for the challenge. Number 2, daily number of people admitted to New York City hospitals for suspected COVID-19. Today's report, 296 patients, so it's just gone up intensely. Confirmed positivity level, this one's 7.69, which I think is either a typo or aberrant, but we'll get an update there. Hospitalization rate per 100,000 New Yorkers, 3.70. Now that said, our hospitals are doing remarkably well. We have real challenges, but what's striking is how different, thank God, how different the Omicron experience is than even last winter, let alone the spring of 2020. So definitely some pressure on our hospitals, definitely a challenge, but much different than what we experienced in the past in terms of the impact it's having on people. Our hospitals are holding it together here in the city, and God bless everyone, all our healthcare heroes who are doing that work. And then the new reported cases, staggering figure, and again, we believe this is going to peak very soon, but today's report, 17,334 cases. So once again, a powerful, powerful reminder how important it is to get everyone vaccinated, everyone boosted as quickly as possible. Okay, a few words in Spanish. And this is about the historic moment today when we implement the vaccine mandate for the private sector to keep everyone safe. COVID es malo para los negocios. Hoy comienza el mandato de vacunas para el sector privado para mantener seguros a las personas y los lugares de trabajo. Vacúnese, póngase su refuerzo y obtenga $100. The booster incentive through the end of this week, Friday. Okay, with that, let's turn to our colleagues in the media, and please let me know the name and outlet of each journalist.
We'll now begin our Q&A. As a reminder, we're joined today by Dr. Choksi, by Dr. Katz, by Dr. Long, and by Corporation Counsel Georgia Pestana. First question today goes to Steve Burns from WCBS 880.
Hey, good morning, Mr. Mayor. How are you?
Good, Steve. How you doing?
I'm good. That was a very neat way to start a Monday morning with Patti Smith. That was fantastic.
I gave me a real charge. I hope you felt it too.
Yes, absolutely. Wanted to start with the private sector mandate going into effect today. I'm sure you've seen what Mayor-elect Adams has had to say about it. He's basically gone out of his way to say he will be making changes to this. He wants to make sure small businesses are able to survive through this. He says small businesses face a very different reality than large corporations. So given that these are your final few days in office, do you see any merit to changing the approach here based on the size of the business? And if not, why not?
No, I appreciate the question, Stephen. Obviously, the mayor-elect and I have talked constantly. We spoke at length yesterday. We've been keeping up to date on a whole host of issues, and we're having a very, very good transition. I obviously care deeply about the small businesses. They've been through a lot, but I'm also convinced that the most important thing to do for a small business is to end the COVID era, get us out of this, and obviously protect everyone, protect the people who work in the small businesses, own them, the customers. And my job is to protect people. So I am 110% convinced this was the right thing to do, remains the right thing to do, particularly with the ferocity of Omicron. And I don't know if there's going to be another variant behind it, but I do know our best defense is to get everyone vaccinated, and mandates have worked. So I'm very comfortable with what we're doing. I totally respect whatever the mayor-elect wants to do when he takes office, but this is the right thing to do now to protect all New Yorkers. Go ahead, Steve.
And just to follow up on that, and maybe your counsel wants to weigh in as well, does it make it at all more legally complicated to specify the size of businesses on a mandate like this? Does it have to be basically all-encompassing, one-size-fits-all, because it makes it more legally challenging to carve out different sizes of businesses here?
You are a perceptive person. I'm going to let Georgia Pestana, who was deeply involved in shaping this mandate, I'll let her speak to the legal thinking, the strategy that went into it. But I think the simple answer is yes. I think the more universal, the better. Not just legally, but it also then creates parity among all the different industries, all different size businesses. So it encourages people to get vaccinated and not think, if they're hesitant, well, maybe I'll go and work in a different company or a different field. A lot of business people said that to us early on, that if we were going to do something, make it as universal as possible, so people would know it's time to get that vaccine. Georgia, why don't you talk about the legal strategy there?
Thank you, Mr. Mayor. As always, we've been guided by the health professionals, and there is no difference in employees who work for a large employer as an employee that works for a small employer. They're all at risk, and there is no public health reason to distinguish the two. The stronger the public health reasoning, the stronger we are able in defending any challenges. We have not gotten any challenges thus far, knock wood. I think that we will prevail should those challenges come, because the mandate is grounded in solid public health advice and reasoning, and that reasoning goes across all sizes of businesses. I will also add that we have, through small business services, had a number of conversations with groups of small business owners to help them understand and get compliant, and they have been appreciative, and we will continue to help people and businesses come into compliance with the mandate, because it's important for the health of the city. Thank you.
Thank you very, very much. Go ahead.
The next is Dana from the New York Times.
Hi, Mr. Mayor.
Hey.
I'm not sure if you'll answer this. I think you're kind of dancing around this particular question a little bit, but if you had to put odds on how likely you think Eric Adams is to continue the mandate, what would those odds be?
Well, I admire both the question and the fact that you gave me the space. I wouldn't call it dancing. I would call it this simply. I'm not going to predict, and he will obviously make his own decisions and speak for himself. But I believe, Dana, truly that the universality is a strength in every sense. So I feel, as he does, a sympathy that small businesses have been through a lot of challenges. But I also believe ultimately it benefits the small business, not only on a health level, but again, if everyone's under the same approach, then for a small business, it does not leave that possibility of someone say, oh, I'm going to leave here and go to this other place because I don't feel yet ready to get vaccinated. No, everyone has to get vaccinated. And what we found is, except for an extremely small number of people who are just, ideologically absolutely set in their opinions, the vast, vast majority of people are moved by both the science, but also the practicality of something like a mandate. That's why we have 91% of adults in this city have had at least one dose, 94% of the city workforce. I mean, if that isn't a recommender for mandates, I don't know what is. Go ahead, Dana.
Thank you. And then on a related note, can you just walk us through what enforcement will look like?
Yeah, very much like we have had with Key to NYC. And I want to remind people, when we made this decision to do a more universal mandate, it was based on actual experience with the private sector in the Key to NYC, indoor dining, entertainment, fitness. There's a lot of prediction in the beginning, oh, this is going to be such a disruption and businesses wouldn't be able to deal with it. And, I hope people have experienced that businesses have adapted very, very smoothly to it. We did a lot of education. We did a policy of an inspector shows up, there's a problem, talk to the business, say, hey, here's the problem, let's correct this. Please confirm you can do that. And overwhelmingly, the businesses have done that. So in fact, with Key to NYC now over months, we had very few times when we had to give a penalty. We will give a penalty if someone flatly refuses, but that's very rare. So our inspectors will be out there energetically, but with the goal, educate and correct, ideally avoid penalties.
The next is Courtney from New York 1.
Hi, Mr. Mayor. Hope you had a good holiday.
And you as well, Courtney.
Thank you. So given the number of cases over the last couple of weeks, I wanted to check in to see if you're experiencing staff shortages at any first responder agencies or really any agencies. I know there's been some reporting on a shortage potentially of EMS personnel over the Christmas holiday. Can we get an update on those first responder agencies, NYPD, EMS, and FDNY, et cetera?
Courtney, thank you for the question. And I'll tell you, first of all, of course, we know in every part of the city that we've seen people out with COVID, thankfully, again, more mild cases and therefore for 10 days. But it has not affected the operations of the city. That's the bottom line. Our agencies are very, very agile and very good at what they do, and they have tremendous resources, but they also went through, the crucible of the spring of 2020 when you were talking about massive numbers of people out simultaneously, and they kept serving New Yorkers to their great credit. So nothing we've experienced in the last few days has fundamentally affected the ability of our agencies to get the job done. Go ahead, Courtney.
And also to piggyback on Dana's question on the enforcement element of this, what agency exactly is responsible for making sure all of these businesses are complying? And are there random spot checks? Is that what employers should be prepared for? Should inspectors show up at small businesses and say, show me your paperwork, et cetera?
Yeah, I'll turn to Dr. Choksi because obviously Department of Health plays a particularly crucial role, but a lot of sister agencies have gotten involved in this effort, as we've done previously during COVID. Yes, of course, businesses should expect inspections as per usual for so many reasons. But again, with an attitude of let's make sure things are working for everyone's health and safety. We're not trying to do gotcha. We're trying to just make sure we keep moving forward. So in terms of health department, how they're approaching it, and obviously leading other agencies in the effort, Dr. Choksi, why don't you jump in?
Thank you, sir. And yes, as you say, it is a multi-agency inspection force, which is very similar to the way that we conducted engagement and then enforcement related to KETA NYC as well. It's a combination of dedicated inspections specific to the private sector mandate, as well as incorporating checks related to the rules under the mandate in other routine inspections as well. But the most important point is the one that the mayor has already made, which is that we seek to work with businesses and business owners so that everyone can come into compliance for the simple reason that vaccination is good for business. It helps us to keep our economy open and running, and it helps to keep employees and all New Yorkers healthy and out of the hospital. Thank you, sir.
Thank you.
The next is Julia from the Post.
Hey, good morning, Mr. Mayor.
Hey, Julia, how was your Christmas?
Oh, my daughter was very sick, so there was not a lot of sleep and a lot.
I'm sorry. Sorry to hear
that's
that.
how it goes.
Yeah. It'll get better as they get older.
Yeah, I hope you and your family had a good holiday as well.
Thank you. Yes.
So just continuing with the same theme here, do you expect the city to issue fines before you leave office in the next few days here? And if not, are you really leaving the difficult part of this mandate, the enforcement part, to Eric Adams?
No, I don't see it that way at all. Appreciate the question, but I'll tell you why I don't see it that way. Because we have a body of evidence. When you think of all indoor dining, fitness, entertainment in New York City, that's a huge number of businesses. We've done this work already and found that we did not need to fine. Now, if we ever do, and again, a few cases we did, and we will. And if a business today, if the inspectors go and the business says, I absolutely positively refuse, of course they're going to get a fine. But that's not what we typically find. Overwhelmingly, we find businesses that are ready to comply. Sometimes they're not sure about some of the details. Sometimes they need some help correcting a situation. But no, if someone refuses, of course there's penalties. But very, very few people do, is our experience with the really substantial body of work we already have. Go ahead, Julia.
At the top, you said that you've gotten a lot of questions and concerns from private businesses about the mandate. What are those?
I think that, first of all, they have wanted to know how inspections would work, exactly what we're talking about here, and we've reassured that the goal is to get to a positive outcome. There's been concern about making sure that they understood what was required, how to go about it. Obviously, that if there was going to be, if they wanted to provide a reasonable accommodation process, how it worked. So it's been a good dialogue, and we've reached out to many, many different business organizations. And what we're finding is broadly an understanding that the universality helps everyone, that the city government leading the way takes a burden off business, and especially that COVID is bad for business, that the one thing that would be most devastating is shutdowns. And so an aggressive action to make sure we do not go back to shutdowns and restrictions actually is very friendly to the needs of business and keeping people employed.
The next is Maya Kaufman from Cranes.
Hi, Mayor. I want to revisit the question of a remote work policy for city employees. Since I've been told that at an internal health department town hall, Health Commissioner Dr. Chokshi had told employees that he and other agency leaders have raised the issue of a teleworking policy with you in City Hall. So why do you continue to resist allowing telework for those workers who wish to do so?
Well, I think, Maya, thank you for the question. I think that what is most important to begin the conversation with is we have a highly vaccinated workforce, and we all know there's a profound difference when you're in an environment where people are overwhelmingly, if not totally vaccinated, everyone. There's a huge difference there. Second, we have workplaces that have been meticulously supported in terms of health and safety measures. So when you're in a public sector workplace, it is, to me, from those facts, it is a much safer environment than many others. but it's also because the work people do is crucial to keeping the city moving. And that work is being done best if people are in their workplaces. So that's what I believe. That's what we've been doing. It has been working. The city government has been performing at a very high level and helping this city to move through COVID and recover. And that's what I think makes sense. Obviously, new administration will evaluate, but I think we've proven time and again that this is what works best here and now. Go ahead, Maya.
Yeah, I want to follow up on that and ask what is the downside of allowing more flexibility for municipal workers, especially given that a lot of workers have children at home who are too young to be vaccinated, who might be around vulnerable people, might be immunocompromised, and really told me they want to have that option.
Maya, there's, first of all, as has always been true, if there's an exceptional situation, anyone can raise that to a supervisor, and supervisors obviously have some latitude to deal with situations. But on the bigger point, it's because we need the very best work done right now. I mean, people who, again, I have a very strong feeling about public service, and people who are in public service take on a particular set of responsibilities. And right now, we're still very much in a crisis. We've got to fight our way out of this. We've got to put the COVID era behind us. Our public workers, I have seen this many times over, the best work happens in the workplace, the most collaboration, the most productivity, the most ability for there to be communication. We need that now. So if there's exceptional situations, of course, supervisors will entertain it. But for what's good for the people, and we're public servants, our obligation is to the people. What we're doing now, I believe, is what's best for the people.
The next is Janae Caldwell from News 12 Brooklyn.
Hi, can you hear me?
Yeah, how you doing today?
Good, how are you?
Good, but pronounce your first name so I get it right.
Oh, it's pronounced Janae.
Janae, okay.
Thank you so much. So I'm sure you know about the really long lines at city testing sites across the city. Some people are telling us that it's taking them as long as maybe 4 days to get their testing results. And we're also hearing that some of the city websites systems to make appointments are crashing because the volumes are just so high. So my question is, are you aware of this issue? And if so, what are you guys doing to expedite the process of people getting the results in just a faster time?
Yeah, thank you for the question, Janae. I will turn to Dr. Katz and Dr. Choksi. I think we've got a couple different things going on. First of all, I don't blame anyone if they look at a site and they look at a line. Doesn't matter to New Yorkers whether it's a city-sponsored site or a private site. They just see testing with a line. We've had a very different experience at the city-sponsored sites in terms of the turnaround time with the test results. I'll let Dr. Katz speak to that. And obviously the goal here is to make sure the information we put out there is accurate and people can get appointments. I know there's been a huge, huge intense demand. So first on the test result time, Dr. Katz and then Dr. Katz and Dr. Choksi on what's going on with the websites and keeping them up to date and whether they are performing even with this high demand. Dr. Katz.
Thank you so much, sir. And it has been a challenge to keep up with New Yorkers who are going for testing, and we applaud them for that. They want to keep themselves and others safe. Happy to say that any test done now at a city-sponsored health and hospital site is having a 24-hour turnaround. I just reviewed the data this morning. We are aware that many of the private sites are running longer turnaround times. So we're very proud that we've been able, because the city built its own lab, we are able to get 24-hour turnaround times. In terms of testing resources, we have redeployed workers to our testing sites to keep lines as short as possible. We recommend people check out the website to look at length of the line before choosing one, because we do note variability depending upon, we can't always control how many people go to a particular site at a particular moment. So New Yorkers on our website can always find a shorter time. Thank you, sir.
Thank you. And Dr. Choksi, certainly update people on the website situation as you're seeing as well.
Yes, sir. I'll provide three brief updates. First, on the websites, as Dr. Katz mentioned, we are seeing unprecedented demand, but for the city websites, we are able to keep up with the appointments that are being made. So I encourage anyone who's looking for a testing site, go to nyc.gov/COVID test, or you can also call 212-COVID-19 or text 85548. If you text COVID test to that number, you'll find a site that is close to you in the zip code of your choice. The second thing that I wanted to mention is, as Dr. Katz has said, for city sites, turnaround time for test results is within 24 hours. For the city as a whole, the significant majority of tests are coming back within 48 hours. But if you do need that accelerated turnaround, again, the city sites are your best option. And the third thing that I'll say is that thanks to Dr. Long and his team, additional capacity is coming up online every day this week. There are 7 new brick and mortar sites that the Test and Trace Corps has stood up for this week. And so for both PCR tests as well as the at-home rapid test kits, that capacity will ramp up through this week and into the new year. Thank you.
Thank you. And Dr. Ted Long has joined us. Dr. Long, any tips you want to give to people who are trying to figure out how to navigate all this?
Yes, the simple tip is come to one of our sites. As of Friday, our turnaround time is now back down to 24 hours median at our lab, which services all of our sites. The lines we're controlling by handing out home kits and opening 7 sites near new today and 40 sites throughout this week. So simply put, our sites are walk-in. Come to see us. We have the fastest turnaround times in New York City.
I like it. All right, Janae, go ahead.
That's all I had for you. Thank you.
Thank you very much.
We have time for 2 more for today. The next is Gersh from Streets Blog.
Well, how you doing, Mr. Mayor? Hope you had a nice holiday.
I did indeed, Gersh, and how was yours?
Oh, fine, very relaxing, and I hope this isn't the last time we talk, but if it is, thanks for taking my questions all these years.
It's my pleasure, and Gersh, we will either meet again professionally or on the softball field.
No question about it. So anyway, Mr. Mayor, driving is something you and I talk about a lot, and driving is up, and it remains a legacy of your 8 years in office. Now, some of it is obviously pandemic related. For example, just use a typical Tuesday, December 14th, about 900,000 cars crossed the MTA bridges and tunnels, which is about 103% more than a normal pre-pandemic day. So that's obviously pandemic related. But total vehicle miles traveled in this city was up almost 2% between 2013 and 2019 before the pandemic. Now that's a small percentage increase, but that translates literally to tens of millions more miles being driven in cars. Now you and I have spoken a lot about the need to improve mass transit and to encourage mass transit, but it is a legacy of your 8 years in office. So I wonder if you could talk a little bit about why you have done not enough to reduce driving, and in fact it's going up.
Yeah, of course, we always have a spirited discussion. And I'm just going to challenge. I don't put that one on my legacy tote board there. I just don't. Look, we have a society that over many years, I remember when I first moved to Brooklyn, there were so many fewer cars around, and there's been an explosion of car ownership in general over the last few decades. That is a bigger societal phenomenon. The answer to it is to create more and more and better mass transit, and to discourage car use in the positive way with mass transit, but also in the smart way with congestion pricing. And obviously, this is something I'm frustrated about because I think it should have been here already. And I believe if we put real pressure on the state and the MTA, we can get forward motion. If we don't, I think they'll just keep slow walking it. So I am very comfortable that we did a lot of the things, foundational things, including what we did with busways and select bus service, expanding bike lanes, NYC ferry. These are all things that are going to grow a lot more. And that's crucial to how we turn around car usage in this city. Go ahead, Gersh.
Okay, sort of a follow-up. I wanted to ask you about today's big public push that you are talking about congestion pricing a lot. Now, you're such a convert at this point, but you were very late to support congestion pricing. So how do you talk to people now who, like you until recently, remain opposed to it? In other words, you had the mayor of London on talking about the positive benefits of it, but there are a lot of people who are still opposed to this, and you've talked about those benefits. So what do you say to them?
I appreciate that question a lot, Gersh. I think, in fact, converts are often folks who can speak with most passion. I had real doubts for a long time. I really did. And it was largely because of the way the plans were constructed that I worried that they would have an undue impact on folks in the outer boroughs. And obviously, I represented a council district in the outer boroughs. And I was not satisfied of what would happen with the money. I remember vividly, with all due respect to Mayor Bloomberg, and to his credit, he was pushing a good basic idea. But the plan, to me, was not structured as well as the current plan. And also, there was not confidence. I remember we used to talk about needing a lockbox to know that the money would actually go to the MTA and not be siphoned off to other needs. This current plan that was finally passed by the legislature, which I strongly advocated for, answered my core concerns. So I became a convert because I said, well, this is a much better plan than anything we had seen previously. Also, the MTA crisis, the subway crisis, grew and grew and grew. Even when you compare to 10 years ago, the challenges in subways are much more profound, and we have to get renewable revenue for the subways. We have to protect the subways, and congestion pricing is the way to do it. So I became a convert because the world changed. Subways got worse, needed more help, and the plan got better. Now I would say to anybody, we're in an entirely different world than when this plan was first talked about in New York City, over a decade ago. We have the climate crisis bearing down on us. We have to take much bolder action. Congestion pricing is part of that. We've got to protect our subways. If the subways don't get better, New York City doesn't get better. And this plan is fair. If you drive on the FDR, but you don't go into the central business district, you're not penalized. There's elements of this plan that are very smart, very fair. And I would urge people, get behind it, because we need to do this now. Also, the congestion crisis, last point, Gersh, the congestion crisis, your numbers you gave are striking. We're all living it, but it's good to hear these numbers. The impact of COVID on people using their private vehicles more than ever. It's been devastating and horrible for the environment and horrible for congestion. We got to turn it around. Congestion pricing is if we're going to break out of this current immediate culture, congestion pricing is one of the best ways to do it. But it's not moving, and the state and the MTA have to move it.
Last question for today goes to Chris from the Daily News.
Good morning, Mayor. Thanks for hosting Patti Smith on today's briefing. That was a great start to the Monday, like someone else said at the top of the briefing.
Chris, I have to say, there's something mesmerizing about her work, but also I didn't know what the effect would be here in this room, but it was absolutely beautiful. Thank you for saying.
Of course. So back on the private sector vaccine mandate, I was wondering, do you or any of the health experts on the call have any data yet on how many reasonable accommodation requests have been received, and any timeline on how long those take to process? And then lastly, if there is actually a deadline by which workers have to submit those requests?
So I'll let Georgia Pestana, our corporation counsel, speak to the process there, and Dave Choksi as well. We had a great experience with the Key to NYC with businesses figuring out the right way to implement things and address employee concerns. I predict the same exact thing here. But we're willing to work with any business with any concerns they have to make sure that if they want to put a process in place, that it is a good process. It's one that can be done quickly and be fair. Let's start with Georgia Pestana.
Thank you. Reasonable accommodation requests by private sector workers go to their employers. They do not come to the city. We're not collecting them. We're not deciding them. It's the employer of the workers that receive the requests and make determinations. As to a deadline, we had suggested that December 27th, today, would be at the deadline for employees who request reasonable accommodations from their employers to get them in, and those workers can continue to work under some kind of accommodation while the employer considers the reasonable accommodation request. But those are all going to their employer, not to the city.
Excellent. And Dave Choksi, you want to add?
Sir, nothing to add to that. Thank you.
All right, great. Go ahead, Chris.
Thank you. And I guess it's kind of on the same topic, but as businesses and individuals across the city are being required to take various health precautions because of the pandemic, I guess I'm wondering, we haven't heard in a while what precautions you're taking. How often are you getting tested right now? Are you taking any other precautions in addition to testing as Omicron continues to surge? Like, what are you doing to make sure you don't get the virus?
Well, thanks for asking, Chris. And I'm doing what the doctors tell us all to do. First of all, I got the booster live on TV, and thank you again, Dr. Choksi. Again, Chris, I can't emphasize enough that's like number 1, 2, and 3 thing to do is get vaccinated to the maximum level you are eligible for right now. We still have, even though 91% of adults are vaccinated at least 1 dose, we still have a lot of people who could get vaccinated and a lot of younger New Yorkers. So that's the overwhelming thing. But it's also, use a mask regularly. Just be mindful. As you know, we were looking forward to gatherings, including with our colleagues from the media, and we, with agreement from a lot of folks in the media, decided we wouldn't have some of the gatherings we might have. So it's a lot of just basic precautions, but I'm gonna let Dr. Choksi weigh in and have the final word here because he has done a great job as the city's doctor of reminding us of the simple, smart ways to protect ourselves, particularly those who are most vulnerable. So Dr. Choksi, tell us again.
Thank you so much, sir. And I really appreciate the ways in which you have emphasized precautions during this uncertain time with Omicron. And our key message has been that there are a number of things that we can all do to protect ourselves, protect our communities, and to protect our city. First and foremost, as the mayor has mentioned, is getting vaccinated. And for everyone who is eligible for a booster dose, get one when it's your time. That means any adult who is at least 6 months after their Pfizer and Moderna second dose, or 2 months after their J&J dose, you are eligible right now, and you should go ahead and get your booster and take advantage of the $100 incentive before the end of the week. The second thing is the importance of masking, particularly masking indoors. And we have made a recommendation to consider higher grade masks like KN95s, KF94s, or N95s for people who are particularly vulnerable and at higher risk. The third piece is getting tested. We recommend people to get tested, of course, anytime they're experiencing symptoms, and sooner is better if that's the case, as well as before and after travel or gatherings. And that's why we've done all of the work that we have to ramp up testing capacity to be able to support that. The final piece is for people who are at higher risk, if you're an older adult, if you have a weakened immune system, or if it's a child who's not yet eligible for vaccination, this is a time to take more care, avoid some optional activities, particularly anything that is indoors and crowded, and allow for the overall level of community risk to come back down as we navigate through the Omicron surge. So those are our key precautions, and if we take them, we will get through this. Thank you.
Amen. Beautifully said. As always, Dr. Choksi, So everyone, just quickly, a programming note that we are going to have another press conference tomorrow. There's a lot going on, a lot we want to talk about. And then final press conference of the year will be on Thursday, the 30th. And again, I'm going to be expressing a lot of gratitude throughout the week. My gratitude to all New Yorkers who have been part of keeping each other safe. Everyone who went and got vaccinated, thank you. It makes such a difference. And please, 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 if you haven't gotten that booster, please get it by December 31st for your sake and your family's sake and everyone's sake. But also get that incentive. Everyone could use a little more money in their pocket right now. And if you've gotten the booster, tell everyone in your life how important it is, because it really is pivotal to protecting everybody and reducing the impact of Omicron. And tell them there's a $100 incentive that goes with it, and you're definitely going to get some people's attention with that. So everyone, thank you, and we'll see you tomorrow.